come down to the Toucan Mall in Amelia's Ward, Linden. It's the mall that has it all. We have great food, a relaxing atmosphere, and activities for all ages. Tennis, swimming, and a playground. But the fun doesn't stop after dark. There's even a bar and an arcade. And if you aren't ready to go home yet, we've even got a spacious room for your comfort, complete with air conditioning, Wi-Fi, and a private bathroom. The Toucan Mall can also facilitate your event in our spacious conference hall. We also have a theater with films for the entire family. It's the Toucan Mall located in Amelia's Ward, Linden. Looking for a place for the whole family? Come down to the Toucan Mall in Amelia's Ward, Linden. It's the mall that has it all. We have great food, a relaxing atmosphere, and activities for all ages. Tennis, swimming, and a playground. But the fun doesn't stop after dark. There's even a bar and an arcade. And if you aren't ready to go home yet, we've even got a spacious room for your comfort, complete with air conditioning, Wi-Fi, and a private bathroom. The Toucan Mall can also facilitate your event in our spacious conference hall. We also have a theater with films for the entire family. It's the Toucan Mall located in Amelia's Ward, Linden.
Alrighty, a very, very good evening to all of my friends and relatives and well-wishers, and those of you who are looking forward to our program once again. I can't believe it, but it's Thursday, and it's been a few hours since it was last Thursday. Seems like the month just got started, but it's the 22nd of October, and in a few days you're going to have another holiday, and then it's going to be Diwali, and then it'll be Christmas, and guess what? The coronavirus is still going to be here with us. So just know that it's going to be here, and we just have to work around it. Well, as we know, it's Cancer Awareness Month, as I would say, and that is coming to an end. The month is coming to an end, in which the cancer is maybe emphasized more. However, I will continue to say that cancer awareness should be practiced every day, not just in 1 month of the year. Maybe recognized, but it should be practiced at least once a week in your life, if not every day. All right. I've always wondered, how is it that persons are having all sorts of cancers? We've been working on theories to cure cancer, as I said, for so long, and yet still, we don't seem to be able to understand what is really causing these cancers. You know, I'm listening all the time at persons who are involved in the cancer drive, and I've hardly ever heard them talk about how is it that breast cancer or uterine cancer or prostate cancer, you know, or colon cancer, all of those, how is it that these things are happening over and over and over, and we don't seem to be getting it? You know, I am of the firm belief that unless we can get to the causes of things, we're not going to be able to even imagine what it will take to get rid of things. And that's a philosophy that I believe in 100%. That is the basis of which I do my work. I don't want to administer anything to anyone unless I'm aware as to what is causing it. And then the other factor is you, the person, also plays a key role in yourself helping to overcome whatever it is that is wrong, be it cancer, be it diabetes, hypertension, whatever it is. So we have this battle of trying to fix things, and at least so it appears, and we're not going to succeed until we understand what makes these things happen. I've been doing a lot of research, and I've been also treating a lot of persons, many persons, and much persons, many persons. And I've seen a lot of what makes things happen. It is a pleasure, it's a joy to work with the device I have, because I'm able to see clearly what is contributing to things. And it helps because it helps to give you some sort of a blueprint to use to at least educate the patients or the persons as to what is really happening to them and why and how to go about changing what is happening with them. For example, many persons, adults particularly, are of the opinion that worms don't bother them. Many persons, many adults are of the opinion that they don't have worms, that worms is for little children. Contrary to that, worms live in adults more than they live in children. The bigger you are, the older you are, the more worms you have. And I want to tell you something. Worms play a very serious role in contributing to many of your diseases, including cancer. Worms. There's so many different types of worms that live in the body of people. It lives in your organism. It lives even in your brains, even at the back of your eyes. Worms live in your colon. They live in your uterus. They live in your liver. They live in your pancreas. They're there. They're there. And guess what? These worms, once they enter your body system in the form of a larva or whatever form they get into, or they get in as, these worms don't come out like that. Very seldom do they migrate and come out unless they're like thread worms or pinworms and they crawl through your rectum. We see that in little children. Why are they there? Why do they end up there? They end up there because they're in your intestine. They're feeding in there. These worms, they eat, they mess, and they multiply all together inside of your bodies. Many persons who are sick because they have worm infestation. Cancer. Many of the factors that contribute to cancer comes from worms. Yes. But yet still, persons are of the opinion that they don't have worms. So how do you convince someone who is ill, who is sick, and they go to the physicians, or they go to the hospitals, and all sorts of things are done, x-rays, CT, blood tests, all the screenings are done, ultrasound, and yet they're told that, oh, you're okay, nothing is wrong with you. It's all in your mind. How could you tell someone that their sickness is all in their mind when they're losing weight, when they're having pains and discomfort, when they're seeing that they're falling apart, when they're not able to function as they should, when they can't stand up or stay up? How can you tell them that they're okay when they're unable to function normally? How could you? There's no way you can do that. There's no way you could be um, having pains and discomfort and everything is okay, you know? So I want you to understand that it is important for you to know that worms plays a serious factor or role in your cancer. Worms. Secondly, um, many of you let me just do this really quick. Many of you are having pains in your lower abdomen, pains in your pelvic region, vaginal discharges, some of it white, cream, brown, odorous, smelly. Some of you even know that it's smelly and you do all sorts of things to keep the odor away. Many of you are ashamed to be in the midst of people because of those odors that are emitting from either your body or your body parts. And you go to the doctor and you have the screenings done, whatever they do, and they're going to come back to you and says, oh, that's normal. The vagina is cleaning itself. I hear that so many times. What is it cleaning itself of? If you have something coming out of you and it's smelly, it has a high odor, it's odorous, it is white, it is brown, it is coffee color, and it has a high scent, and you're told that it's okay, it's normal, the body it's actually the vagina is cleaning itself or whatever stupid excuses are given. Nothing should come out of you with an odor, not even with your breath. Not even your breath. There is foul or stale, because you're talking all the time, you don't brush your teeth, maybe you eat something, but if you have an offensive odor coming out of you in any form, in your pores, in your mouth, in your breath, through your vagina, even when you pass gas, my friends, it shouldn't have a high odor. If you have a high odor coming out of your system, be it your mouth, your vagina, your rectum, whatever, it means that something has gone wrong inside of you. Don't be fooled. Don't be fooled. It is not designed for you to have high odors coming out of your body. It means that something isn't functioning properly or something you ate is not working good for you. That is the reason why we would, in every instance, present you with a copy of a document that says, these things you should avoid. Why you avoid them? You avoid them because they're provoking your conditions more. They're making you more sick. It's not Dr. Haynes giving you that. It's coming out of your body. It's your body and the diseases that are detected that is saying to you, listen, if you want to get better, stay away from these things. They're making your condition worse. These are the same things that are causing you to have those odors, much of them. Many of you are gluten intolerant. You have celiac disease and you don't even know it. You cannot have normal bowel function, normal digestive function if you have celiac disease or you have gluten intolerance. You wouldn't. How do you know you have it? Who will tell you that you have gluten intolerance? Many facilities that you go to, they can't tell you that. We can tell you though. We can tell you at our facility. We can tell you if you have parasites. We can tell you if you have the coronavirus. We can tell you all sorts of things without any invasive type of sampling. I don't think you understand what is happening at our facilities. I don't think you understand. I don't think most of you understand. I think when you come, you go through the process and you don't really know what happens. You know, you wonder, how is it that this thing can tell me all of these things? How is it I could have all these diseases? Well, we don't put them in there. I want you to know that we don't put your conditions, your diagnosis in there. We put nothing in there. All we say is that, look, you have a headache? Yes, you have a headache. Tummy hurting? Where? Boom, we put that in. You have a knee pain? Yes, we put that in there. You have whatever it is. But we don't give you the diagnosis. What you must understand is that when we screen you, it is your body telling us why you have the headache, why you have the knee pain, why you have the tummy ache, why you have the vaginal discharge. Many of you women and men out there are walking around with STDs, sexually transmitted diseases, and you don't know it. Many of you, lots of you. And you're transmitting it to each other back and forth, and others, and you don't know it. And you don't know how far those things go. You don't know how far those diseases go. Those sexually transmitted diseases end up all the way to the grave. They will take you to the grave. You don't fix them right, they'll take you to the grave. Many of you will get cancer from that. Why? You will get it because it's in your body system, eroding your cervix, eroding your uterus, destroying your ovaries, killing your eggs when you want to get pregnant. You all don't know. You don't understand. Many of you wondering why you're not getting pregnant. Well, you're not getting pregnant because you have a problem, and the problem is not detected. That's why you're not be able to conceive. But you're told, oh, you're fertile, oh, you're okay, but yet still nothing happening. You see, and you don't believe it. Most of you, when we give you the diagnosis, you don't believe it. I'll remind you again, guaranteed accurate in the world, 96% in diagnosis and treatment and recovery if you follow the rules. If you follow the rules. You wonder why you're having cancer? You need to find out what is the cause, the bottom. What is it? What made it happen? All of us have these cancer cells in us. Don't let nobody fool you. We all have the cells. The problem comes when those cells have been activated. What activates those cells? Well, the body does not like impurities. Toxic matter. What activates the cells? The cells are activated from toxicity. It's activated from the parasites that defecate in you, that multiply in you. Can you imagine there's a worm that multiplies, that produces 300,000 eggs per day for a year? That's a lot of eggs. That's a lot of eggs. That's a lot of worms if they all manifest. And that's just one worm. We see every day people who are screened and they wonder why they're not, why am I losing weight? Why I'm doing everything right. I'm eating right. I'm eating all of this meat and fish and chicken and everything, and I'm still losing weight. Why, doc? When we screen them, they're worm infestations. So what are you doing? You're eating, but you're feeding the worms. Remember, they're eating, messing, and multiplying all inside of you. They're not coming out. They're not coming out. Unless you kill them or unless you force them out. So we need to look beyond the condition. Beyond. The condition is like the light that comes on in the dashboard. It says engine. If the light on the dashboard on the vehicle or the motorcycle comes on and says engine, what are you going to do? You're going to stop it and plug the fuse out? Some people do that. Some persons stops the vehicle, checks it, pulls the fuse out, and just keep driving. Next thing you know, the oil light comes on. So what are you going to do? Stop the vehicle, plug out the oil light, the oil fuse, and keep driving again? then the next thing you know, your engine is going to blow. You see, we've got to get to the point where we understand what is causing our problem. We have to. All right, my operator wants to take a break at the halfway mark. And as soon as she gets done with that break, we're going to come back once again. Stay tuned.